Hello everyone. In this video I am going to explain what are medicines. Medicines are something we all use in our daily life. Like if we get fever, cold, cough, headache or any infection, we take medicines. But most of the time we don't really think about what medicines actually are. So today I'll explain it in simple way, step by step. So first, what are medicines? Medicines are substances that help us in many ways. They can help to prevent diseases, find diseases, treat diseases, and sometimes even cure diseases. Also, medicines help to reduce symptoms. For example, if you have fever, medicine helps to bring the fever down. If you have pain, medicines help to reduce the pain. So overall, medicines help us to stay healthy and feel better. Now let's talk about why medicines are important. Medicines are very important because they help in both small and serious health problems. Medicines can prevent dangerous diseases. Medicines can treat infections. Medicine can also help people who have long-term diseases like diabetes and blood pressure. They also help to reduce problems and make the patient feel comfortable. So yes, medicines play a very big role in healthcare. Now, medicine are not only used for one thing. Medicines have different purpose. The first purpose is prevention. This means stopping the disease before it happens. A good example is vaccines. The second purpose is diagnosis. Some medicines are used during scans to help doctors find the problem clearly. The third purpose is treatment. This is the most common use. Medicines treat illness and help the patient recover. The next purpose is cure. Cure means disease is completely removed. Another purpose is symptom relief. This means reducing symptoms like pain, fever, cough, and discomfort. And the last purpose is palliative care. This means giving comfort to the patient, especially in serious diseases when full cure is not possible. So, medicines can prevent, treat, cure, and also give relief. Now, let's quickly talk about the history of medicines. Medicines have been used for a very long time. Earlier, people used natural things like herbs and minerals. Then, traditional systems came like Ayurveda and Unani. After that, modern medicine started developing, and many important discoveries happened, like antibiotics, vaccines, and anesthesia. And today, medicines are more advanced with biotechnology and new research. So, medicines have grown a lot from old times to today. Now, let's understand dosage forms of medicines. Dosage form means the form in which we take medicines. Some medicines are tablets and capsules, some medicines are syrups and injections, some are creams and ointments. We also have special forms like inhalers, eye drops, nasal sprays, and patches. So medicines comes in different forms because different people need different type of medicines. For example, some people cannot swallow tablets, so syrups are easiest. Sometimes injections are used when we need fast effect. Now let's talk about route of administration. Route of administration means how we give medicine into the body. The common route is oral, which means taking it by mouth. Some medicine are given through injection, some are applied on skin, some are inhaled through breathing. So the route is important because it decides how fast the medicine will work. Some medicines work quickly and some take more time. Now let's talk about where medicine come from. Medicines can come from natural sources like plants, animals, microorganisms, and minerals. Medicines can also be made in labs, which are called synthetic medicines. And some medicines are made using biotechnology like vaccines and proteins. So medicines can come from nature or from labs. Now let's understand classification of medicines. Medicines are classified based on their use. Some medicines are for pain relief, some medicines are for fever, some are for infection, some medicines are for diabetes or blood pressure. Medicines can also be classified based on different medical systems like allopathy, Ayurveda, homeopathy, Unani, and Siddha. Classification helps doctor choose the right medicine. Now let's understand a very common confusion. People often think drug and medicine are the same, but they are not exactly the same. A drug is the active part that gives the main effect. A medicine is the final product that we take, like a tablet or syrup. So medicine is a drug plus other supporting ingredients. Now those supporting ingredients called excipients. Excipients are inactive ingredients. They help the medicine in many ways. They make the medicine stable, they improve taste, they help in absorption, they also increase shelf life. So excipients do not treat directly, but they make the medicine better. Now, how do medicine work? Medicines work inside the body in a specific way. They act on certain parts of the body and produce an effect. Some medicines kill microorganisms like bacteria, some medicines control body chemicals, some medicines replace missing substances in the body. So medicines work in targeted way, not randomly. Now there are two important terms. First is pharmacokinetic. This means what the body does to the medicine. It includes absorption, distribution, metabolism, and excretion. It basically explains how medicine moves in the body. Second is pharmacodynamics. This means what the medicine does to the body. It explains the effects of the medicines. So one is about medicine movement and the other is about medicine action. Now let's talk about side effects. Side effects are unwanted effects that can happen after taking medicines. For example, some medicine can cause nausea, dizziness, sleepiness, or dry mouth. Side effects are not same for everyone. Different people may feel different effects. Now, adverse drug reactions are more serious than normal side effects. These are harmful reactions that can happen because of medicines. Some reactions happen due to high dose and some happen due to allergy. So monitoring adverse drug reaction is very important for patient. Now let's talk about drug interactions. Drug interactions happen when one medicine changes the effect of another medicine. This can make the medicine too strong, too weak, or can cause unwanted effect. So it is always better not to mix medicines without doctor advice. Now let's talk about drug toxicity. Drug toxicity means harmful effects due to too much medicine in the body. It can happen due to overdose or long-term use. Toxicity can affect organs like liver, kidney, heart, and nervous systems. So medicine should always be taken carefully. Now, safe use of medicines is very important. Safe use means taking the right medicine in the right dose and for the right duration. Also, avoid self-medication and always check expiry date before using any medicine. So correct use is very important. Now medicines are also regulated to make sure they are safe. There are regulatory bodies that check medicine approval, quality control, and safety monitoring. This helps to protect people from unsafe medicine. Now, finally, conclusion. Medicines are very important in healthcare. They help prevent diseases, treat illnesses, reduce symptoms, and improve comfort. And if you understand medicines properly, we can use them safely and correctly. That's all for this video. Thank you for watching.